is healthcare administration, does it count more as a business degree, or is it kind of like a fusion of that?
Okay, that's a really good question. So it's what you make of it. So let me give you guys a quick breakdown of how this works. So I'm going to talk to you guys from like a MedStar or Kaiser perspective instead of a normal nonprofit hospital, just because I think it gives you guys a better broad view. So once you go into healthcare administration, there are a ton of different ways to go about this. Now, if you want to look, let's talk about it quickly, more clinically. So for me personally, like I said, I love science. I love this stuff. So I will go into it more clinical management. So traditionally in these big hospitals, you'll have a doctor so let's talk about cardiology, the cardiology department. You'll have, let's say, a group of 10 cardiac physicians. You're going to have one physician that's kind of the leader of the pack. He's the one kind of nagging at the supply chain analysts, nagging at the administrators. I need this, we need that. He's the spokes guy, or she's the spokesperson for that group. Now you have the clinical admin side. So there's a backbone of other people who also have it opposite. So you'll have, I could be a director of cardiology, but I'm not a cardiac physician. This is just the department I'm in charge of. So when it comes to, say, for example, hiring a new doctor, right? That doctor has to go through two people. You're going to have an interview with the head physician, him or herself. And you're also going to, just to make sure clinical skills are there. Then you're going to have an interview with a healthcare admin, like potentially someone like me. And I would be the one just to check about your regular interview day to day, like responsibility, organization, those type of things. So that's one aspect of healthcare administration. And then typically in a hospital, you would do your MHA degree, right? After your MHA degree, we still have residency. So I have to do residency for 1 year. Traditional programs, it's 2 years books, 1 year residency. However, at USC, it's 1 year studying, and then your second year, you're doing a hybrid. You're doing your residency along with doing your classes. And the benefit of that is you're learning at the same time. Residency, again, could be under a CEO, a COO of a hospital. It could be whatever you want, basically. It could be more clinical based, but it could also be if you want to go more business based. It's really, truly up to you. And then after your residency, you become traditionally like a project manager if you want to go in that end a little more businessy, or if you want to go operations and management in the clinical side. So there's different niches you can hit. And then after that, you become a director and so on and so forth. So you can be clinical, but you can also be business. You can also do healthcare admin with an MBA, but again, you'd be doing finance, accounting in that realm, because a hospital, like I said, is also business. But you need healthcare admin because we know clinical as well. So it could be a mix, or it could be really skewed either way. It's up to you what you want to do.
All right, and I know there's like, what would you say about what you did in school was the best thing for you to get where you are? So any programs, certain classes, AP, high school and in college?
Yeah, so high school wise, I mean, looking at my career and what's helped me high school wise was really honestly getting really involved. At PHHS, I was in ASB, I was in Med 101, I was in NHS, I was in the Indian team. I did all these things because that helped me build my leadership portfolio. Because as a healthcare administrator, you're also essentially a leader, whether it's a group of like 20 people, a group of 2-3 people. You're gonna know leadership skills. You have to have those interpersonal skills. So I think high school honestly helped me with that. But actually, now that we have Mr. Vasquez on the call, one of my biggest movements when it came to liking medicine stuff was his physio class. And I don't know if he remembers this, but I was actually the youngest in his class. I was a sophomore that transferred in. And at that time, they only took juniors and seniors. So I was actually very nervous. But so I ended up working a little bit harder in his class because of that. But that made me realize I like this stuff. It's cool to me. So his class honestly gave me that. AP wise, I'll be honest, when I'm looking at college admissions today as a graduate student, they really just care about your GPA. If you took 5 APs and the guy next to you took 2 APs, okay, but the other person's GPA is higher, I'll be honest, they look at the GPA. So I wouldn't overload the APs. By the time you get to college, they're still gonna make you take them. I had to take stats and I was so annoyed. Like I was like, seriously, I have credit for this. So you're gonna still take them because you're young. You guys are gonna switch your majors. You guys are gonna do a ton of things to help find yourself. So what I'm saying is don't overload yourselves with APs. Don't stress yourselves out. That's the biggest thing I can tell you. No one told me that. I wish someone did, but don't take too many AP classes. It's really, really unnecessary. And I'll be honest, no one even cares about that the second you get into undergrad. Now, when you're an undergrad, stuff that helped me, was getting involved in stuff that exposed me to different aspects. So I did research at UCSF as well, and research at UCSF was amazing, but it made me realize I'm for sure never doing research. But it made me realize that because I did it. I did free clinic, and that's what taught me I like working with patients, but maybe I'd like to be more on the backbone, trying to make things more efficient, because I like the big picture. Same thing as captaining my dance team. It taught me big picture. And that stuff personally led me to where I am. Classes wise, I love taking any leadership policy classes, but also clinical. I was a bio major. I enjoyed all of biology. I enjoyed physio, anatomy, like those type of things. Still follow what you like to do. So that's advice I can give you. If you have any curiosity on anything, go for it, because you're not going to know until you try. And I'll be honest, if you're worried about embarrassing yourself or whatever it is, like, no, you're not going to know all those people after 4 years, you know? So like the way I look at it, when I was in high school, I actually was kind of introverted the first 2 years, believe it or not. I'm talking to you guys right now, but the first 2 years I was extremely introverted. And then one of my family friends who actually went to Piedmont, she graduated in like 2010. She actually, I don't know if she had Mr. Vasquez, and I think she did, but she told me like, you should just do everything you want to do, because the high school is a time for you to learn. So don't be afraid. That's what I can tell you. If there's anything you want to try, go for it. That's what's helped me.
Could you break down kind of like the general education pathway from healthcare administration? Like after you go to college, what is it like going to graduate school, going to residency, and doing all those things?
Sure. Yeah. So you have a choice here. So like we said, MHA is not exactly an MBA, so you don't necessarily need work experience, but certain programs like University of Washington required a year. So I did have a year, so I unfortunately got into that one as well, but certain schools will require a year, but certain schools won't. It's like USC doesn't. So it's up to you. So what I personally did after I graduated, I worked 1 year because I felt like I needed to. Then in that process, I applied just like you guys are applying right now to college. I applied to graduate school. I only applied to UCSF, University of Washington, and USC. Reason being is because when you do healthcare administration, it's really important to try to kind of take it in the state you're kind of trying to live at, only because health policies and things like that do vary state to state. So personally, I really wanted to stay on the West Coast. And then after that, I fortunately got into all three, so I'm thankful for that. But I chose USC because of their residency built in. So I mentioned residency to you guys. Normally in George Washington, Georgetown, and all these other universities like Johns Hopkins, it's the traditional studying for 2 years, and then you have to apply for residency. It's kind of like match day for doctors. It's the same thing. And when you're applying for things like that, it's very competitive. And because healthcare admin is a very growing field right now, most hospitals will only have 2 spots for healthcare admin residencies, whereas for a doctor's class, for the doctor residencies, it's 15 spots, normally 15 to 20. So when you're applying to residency, it's a competitive. And I chose USC because they guarantee you a residency. So all of LA is basically in Orange County is kind of blocked off for USC students, which is nice because you don't see that anywhere else. You only see that USC, and then you see that in Seattle at UW. Those are the 2 programs where you'll see that at. And it's beneficial for you because you can stay in your local area, but learn the health policies of that area. So that's what I did. And basically, I'm in my first year still. I'm applying now in January. I'm going to have my residency match showcase. So we meet a ton of people like Kaiser, Optum, Scripps, name it, like all these healthcare groups and hospital companies. And they interview you, and it's kind of like crazy. It's like you put down your top 3 that you like, and they put down their top 3 people, and if you match, then you get to go there. So I'm kind of about to walk into that tornado. After you're out of that, you do your residency, and what that looks like is you work from 8 a.m. to about 4 p.m. every day, and then your classes start at 6 p.m. right after that. So you go from 6 to 9 p.m., and that's your typical day as a master's student in your second year. And then after that, if the company likes you enough or they have space, they'll offer you a full-time, whether that be like of a first level manager or of whatever type of analyst you are interested in at that healthcare group. Or some people then go the other way where they'll do a fellowship. Fellowships in this field, and especially in the United States, are extremely competitive, but very beneficial. So what a fellowship will do, it'll teach you different aspects that you're still unsure of. It'll give you like a little bit of a rotation. So you'll be able to learn what is the cardiac department like, what is the ER like, what is the ICU like as a healthcare administrator. So that's what a fellowship is. And that comes for 1 year after your residency, and then you start the full-time job. So the fellowship is optional. So the residency is definitely ideal. And then after that, you can choose whether you want to do fellowship or not, depending on your healthcare system. So that's kind of the path traditionally. But again, this field is so up and coming that I've met so many healthcare administrators who are like EMTs first, or who are doctors first, or who are nurses, who are all these types of things, because they personally just didn't know about the field. And when they discovered it, they were like, oh, this is something that I would like. So there's a lot of ways, but this is traditionally the path that most people will take.
All right. That was that is very complicated, but yeah, I can see people writing it down, like getting it down. So, what was the most challenging? What was the maybe what was your favorite part of what you had to do? Like, what was your favorite, I guess, requirement? Requirements really aren't favorable, but what was your favorite requirement, and what was kind of like the thing you kind of like dreaded looking forward to?
Yeah, I mean, I guess my requirement was what I dreaded. So they made us take a second level of stats at college. And I never didn't like statistics, but at some point it was a little too much for me. I was like, seriously, I have to take this too. So for pre-med, you're going to have a ton of requirements, right? Like OChem and whatever it is, chemistry, this many years of this and that. For healthcare administration, you can be anything in undergrad. You can be policy, you can be political science, you can be biology, you can be whatever you want to be, but you have to take, I think, 2 levels of statistics. So that's what it is. I mean, I do like how you have that freedom though. So you guys sitting here thinking like, oh, do I have to be a bio major to be a healthcare administration? No, you do not. You can be anything you want to be. And a lot of schools have public health undergrads. And I've noticed traditionally a lot of public health people go in, or you'll see some people in my program who will traditionally be like, oh yeah, I was a bio major because I was pre-med. And then last minute I was like, okay, I'm not going to do this. And I went into that. So you'll see things like that. But what I look forward to, honestly, was all the networking events and things like that. And I'm right now part of Student Health Council at USC. And this week I also became a student ambassador for the Price School of Public Policy. So getting involved is something I look forward to. Yeah, but it's not bad. You look at stats compared to having to do like 10 different classes for pre-med, I couldn't complain that much because of that.
And what would you say is kind of you said there's a lot of freedom of choice, but what would you say is the most recommended major to go into for a healthcare administrator?
So that goes back to what you guys like personally. If you plan to do clinical more, right, then I would think, but you don't want to do those heavy bio courses, then I would say public health is nice because you really understand like population-wise, demographic-wise, also how does that affect healthcare. And I think public health is great if you are like, I for sure want to do administration, but I want to be clinical. I think public health is good. I'll be honest, I spread myself really thin with biology, with a lot of stuff I'm doing, because when you're a bio, neuro major, all these things, you're gonna be studying a lot. I'll tell you guys right now, you'll be in the library all the time. But again, it's all about time management. So I think public health is really good because it gives you a good, idea of everything going on. But if you're going, as I said, if you want to go more policy way, you could do political science. You can do a lot of different things. Business even. You can do an undergrad in business and then go into healthcare. It's up to you.